Welcome back to our channel, and today we are diving into a very confusing topic, a question that many patients ask me. And the question is, can you have a normal cystoscopy and still have interstitial cystitis? So today I will try to answer this question. Hello, I am Bolaka. I am founder of Interstitial Cystitis India. And today, let's see what is the relationship between IC and a normal cystoscopy. So, let us understand what is a cystoscopy. A cystoscopy is a medical procedure in which a thin, flexible tube with a camera at the end, which is known as a cystoscope, is inserted into the urethra and guided into the bladder. It is used to examine the lining of the bladder and urethra for any abnormalities such as inflammation, tumors, or signs of any infection. So, we have another video on cystoscopy and hydrodistension. So, if you want, you can watch that also. Now, the question is what is the confusion? This is a simple procedure. You should do it and you should get a result that if there is interstitial cystitis or not. But it is not so simple because it has been seen that you can have a normal cystoscopy. That meaning that the lining of the bladder appears absolutely normal without any obvious signs of inflammation or damage. However, you are still experiencing the symptoms of interstitial cystitis. So that is what happens that मैडम what happened क्या हुआ मेरा तो पूरा रिपोर्ट नॉर्मल है फिर भी मुझे डॉक्टर क्यों बोल रहा है कि मेरे को आईसी है. So this seems like a confusion because often what happens, actually let me get back to this thing that medical literature, when it comes to interstitial cystitis or bladder pain, there has been a lot of debate about whether or not cystoscopy should be used to diagnose and classify ICBPS. Some experts from the European Society for the Study of Interstitial Cystitis, which is ESIC, say that cystoscopy is necessary for diagnosis, while others, like the American Urological Association, think that it is only needed for complicated ones. Even the specific protocol for cystoscopy and hydrodistension is different from country to country. In India, Gibbs also feels that cystoscopy is necessary. However, I have seen that some doctors are very pro cystoscopy, while there are some who are like, okay, fine, maybe let me see, and they don't want to immediately jump into cystoscopy. But majority of them, they would actually want to do a cystoscopy. And so, what happens during a cystoscopic evaluation? The two most common things that doctor might see are Hanna's lesion and glomerulations. Hanna's lesions aren't very common, and only 10 to 15% of patients with ICBPS show consistent cystoscopic signs for Hanna's lesion. Earlier, so now they are actually thinking of making Hanna's lesion separate from ICBPS. While cystoscopy can help diagnose Hanna's lesion, the results might not be conclusive for patients who doesn't have Hanna's lesion. So the reason behind this lies in the complexity of the disease itself. Unlike some other medical conditions, IC doesn't always leave clear, visible markers during a cystoscopy. It might be related to the fact that IC could involve deeper layers of the bladder wall or even result from nerve related issues which wouldn't be easily detectable through a routine cystoscopy. So, when Faced with a situation where symptoms persist despite a normal cystoscopy, your doctor might include a hydrodistension. In fact, most doctors they prefer hydrodistension and cystoscopy, like cystoscopy with hydrodistension. So, hydrodistension involves filling the bladder to potentially reveal hidden signs of inflammation to get a more comprehensive view of the bladder. So, to conclude that it can happen that you can have a normal cystoscopic result, but in spite of that, you may have IC. So, there, as I have said in my previous videos, that IC is a diagnosis of elimination. So, your doctor is trying to eliminate other disease to get to the root and find if you have IC or not. So, before I finish this video, I just wanted to remind you that patient experiences are really important. It can be frustrating when your cystoscopy results come back normal, but you're still feeling pain and discomfort. So, talk to your doctor about your concern, or else you can always contact us. Don't hesitate to reach out for help. And I want to remind you once again that on 30th, we are having a free webinar for IC patients, and the theme of that webinar is medical gaslighting. So, if you're interested, please email us, get in touch with us, and be a part of that webinar. So, for today, this was what I wanted to say. Thank you very much. Thank you very much for watching.